Hi, good morning. We got a question on our Instagram page, I believe, from a mom whose son is 18 years old, had a rectus femoris injury, still having problems with it, and was wondering if we could do something for that. So what we're going to do is videotape treatment for that. We're going to send it back into the comments where the mom asked the question, and then hopefully get her to videotape her treatment of it and let us know how that went. So the muscle that we're going to be working on is the rectus femoris muscle, and that's this thing right here, right in the middle. It comes down and attaches to the knee, right up here, and then it can pull all the way up into the hip. So anyway, we'll give some ideas about how to correct that. And so I'm going to be using household items like a plunger handle. Now this is brand new, has not been used in a toilet, and I suggest getting something that hasn't been used for something like that. All we're going to do is take this thing off. Now we put a little cap on here, that's not necessary, but anyway, household items, because you don't have massage tools typically. So we're going to show you how to use this thing to treat that injury. So I'm going to turn this around back this way, and let's see, you're good right there. We'll see how this works. All right. So rectus femoris is a muscle right in the middle of the quad. Go and flex your leg. Flex that muscle right there. It comes down this way, comes all the way up, and attaches this way. So the way that you would go about this is, first of all, find out which end is hurting more. If it's hurting more down here or hurting more up here, start where that muscle starts and do cross fiber. So you're trying to find the tighter muscle that is being affected. So anyway, let's just say you're gonna have to palpate and just find out which one's most painful. So in order to treat this, what you're going to do, the method is you're going to block blood supply to this muscle temporarily so that you can keep it from getting oxygen so it can't contract. Because if it doesn't get oxygen, it can't breathe, so it can't contract. And that's important because it shuts that muscle's defense mechanisms off. Once you get it pinned and you're blocking blood supply, once it softens, then you can start shortening the muscle and lengthening a little bit at a time, so that you can pull the fascial sheath in the muscle across the area being pinned. And when you do that, it will be pulling that tissue across there, and after a while it just lengthens muscle and the fascial sheath. So it's like it's taking bunched up cellophane and pulling it back to its original position. Once it gets here, the pain goes away because there's no reason for the pain anymore. It's just incredibly simple. You just have to know what part of the body to work. So I'm going to come over here. I'm going to make sure, go ahead and hold that right there just for a second. Okay. So you can start off, this doesn't require much strength or anything because you're just leaning into it. And you're going to get down on this and just put enough pressure that it's blocking blood supply. You're not trying to crush it, you're just kind of blocking. And then we can have him to start to flex that muscle. Go ahead and actually pull it up, shorten it, and then just very gradually up and down. Now you may want to have somebody assist the movement of the leg, because if you right on the right muscle, if this were really injured, it would be extremely difficult for him to pick his leg up or drop it down while it's being blocked. Anyway, you can do this and you hold this until you actually feel he feels the pain go from painful to just feeling like pressure. So that's one of the ways that you can do this. So I'm just using household items because, again, most people don't have access to massage tools, which many times aren't really helpful anyway, for specific things. Anyway, you're just going to do that. You can get more specific with this by finding a spot. Let's be more, see how bouncy that is? That's really bouncy. Go ahead and raise your leg up. No, that's not going to help either. Just drop it down. Here's what I want you to do. I want you to hold this, push down, and try to hold it in that position, both hands. And just really get in there. Okay. Now just straighten your leg and bend your leg. Just up and down, and try to make sure that doesn't bounce off of there. This may be good for the person who is actually doing it to actually do this on themselves. You can get something smaller. This is just a dowel rod. I think it came off of a towel rack or something. You can do that. It's a little bit more, a little bit smaller. Pin that in there. Let's see. Something else. This is just a Yeti cooler. You could push down on that with it flat across there, or you could use the edge of it like that. Hold that down on that and just push through it until, again, you're doing this until you feel the muscle actually stop hurting. Because once you do that, it's actually lengthened all the muscle and the fascial sheath to keep it from giving your body the signal that it's too tight. And what your body's trying to do is slow you down so you don't tear or break something if it's too tight. So once this is lengthened, it'll take the stress off of the knee and off of the hip where it attaches up here. Anywho, that's a very quick representation about what this does. I hope that helps. Let us know once you see this. Try the treatment at home. You can ice that area first for about a few minutes. Put an ice pack on it or an ice cup and just rub it up and down there to get it numb-ish before you get started, and that will make it less painful, and it will release quicker. So an ice pack or an ice cup. So with an ice pack across this way or across this way, and then bend and straighten your leg while it's on there. Do that for about 10-15 minutes, and that should help numb this out. You can also use an ice cup. We have these. I think they're on our website for sale. Anyway, you get a towel underneath there, and you just rub that and kind of pull up towards the heart. Just go through that, and then apply the pressure from the plunger handle or another tool that you can use that will dig in there. This will calm this down. This can also be used as a diagnostic tool, because if you're doing this and the area that's really tight and contracted will remain white, while the areas around that actually get red because they have blood supply, but the injured area or the tight muscle does not have proper blood supply to it, so it's going to remain white longer. So you just keep doing this until that gets pink. That'll help calm it down and make it a lot less painful when you do it. You can also, instead of this, if you have a styrofoam cup, you fill it up with water. You can cut the top, once it's frozen, you can cut the top of the cup off, turn around this way so you have styrofoam in this hand and ice on this hand, and then you just be rubbing it that way. It's another way to do this. You don't have to spend any money on it. All right, good luck, best of luck. Let us know how it goes. Talk to you soon. Bye.